Anita is going to read for some of the people back home that couldn't be here, and she's going to help one of our favorite guys from Rochester, Anthony.
Good afternoon. Good afternoon. My name is Anita Cameron, and I am reading a written testimony on behalf of Stephen Mintz, who's an ADAPT member from Rochester who was unable to make it. And Steve brought in a number of points around his housing, so I'm going to read his testimony. Back in August 2004, while I was receiving mental health treatment when I was going to an outpatient mental health clinic, I was forced by my mental health treatment team to go into a group home setting instead of living on my own. When I was trying to stick up for myself, Medicaid provided the insurance, and when I was going there, my Medicaid and Medicare stopped and started, almost leaving me depressed, and worse, the care where I was going was bad. Furthermore, when I was going to Strong Ties in Rochester, New York, my doctor gave me too much medication. I was taking 9 different psychotropic medications. I could hardly think straight, and they told me in a roundabout way that I would never get better. I was like a zombie. I was told that if I went to a group home, I would have to attend more of their groups, and it was almost like they were going after the Medicaid money and not helping. In that succession of time, I ended up in the hospital 6 times that year. I will reiterate that my insurance of Medicaid was stopping and starting. This happened over the span of time when I was receiving mental health treatment. When I wanted to become my own representative payee, they would not let me do that either. They always thought that I was not responsible for my own well-being and care. During this time when I was attending that program, when I was taking medication for mental health, I gained high amounts of high cholesterol as well as high glucose, and during that time I had 2 EKGs done. Then around Christmas of 2004, my family insisted that I go to a group home and go to more day treatment groups. Since then, I've taken a stand. I'm in my own apartment. I have a choice, and the governor of our state has made some changes to the public mental health system. He also took a stand as well when he was Attorney General. Stephen ties us into the Community Choice Act, this housing situation. He says if the Community Choice Act is passed, it will save lives and bring a voice to those that want to take a stand as well for others. Since my new journey, I am advocating for others. I rely less on Medicaid dollars and as well as Medicare. I'm also working as a result of learning on how to take a stand. Stephen is a community advocate. I haven't been in a hospital in almost 3 years, which is huge. I hope person-centered planning will pass in our state along with the Community Choice Act. I believe folks will work again and take a stand in the community like I have. If it weren't for ADAPT and a couple of cool people, I would not be here standing in front of you. Stephen thought he would be here. I would still be caught in a system that doesn't work where it needs to work with all types of disabilities so that everyone can be heard and live and promote the good quality of life. So please hear us. Let us have the American dream. Let us have a chance to be all equal as one. Stephen Mintz. I'm going to say a couple of words on behalf of a gentleman named Timothy Lucas, who had an odd situation, whereas he was in a nursing home and had suffered a stroke, and because of the stroke had some brain injury and behavioral problems, and instead of helping him, the nursing home dumped him, took him to his county social services office and dumped him with no wheelchair, no medication, no nothing. The the social services office was able to find him some housing, but the housing was unsafe. It was inaccessible. There was a step to a ramp. Okay? The man uses a wheelchair. They have a ramp, but there's a step in front of the ramp. Okay? He's in a hotel. The room in a hotel was supposed to have been accessible, but the only reason that they called it accessible is because it had a couple of bars in the bathroom. And because he has the use of one arm, and the bars were on the side of his affected arm, he couldn't use them. The hotel also had a bumblebee problem. So he was definitely in a situation where he was had an unsafe discharge, unsafe housing, and now is forced to go back to a nursing home, to that same one that dumped him, because he has unsafe housing. So, you know, hopefully the second time around, he's hooked up with the Center for Disability Rights now. So we're going to make sure that they get it right, and the next time that Tim is able to go into the community, that he will have the services and supports that he needs, and will be in safe, affordable, accessible, integrated housing.
All right.
My name is Anthony Gregg. Come got life story about me gonna let me gonna I need a time and radio.
My name is Anthony Griggs, and I live in Rochester, New York. I was living in my mother's house for 28 years. I was sleeping in the living room with no privacy. When people came over, they saw me in bed. My family members asked my mother to put me in a nursing home, but I told my mother that I did not want to go. My family took me to a judge, and he said that I was not safe where I was, so I had to go to a nursing home. I was in a nursing home for 3 years, and I did not like it. They treated me bad. I had to fight to get out. I lost everything when I went to the nursing home. Money, checks, furniture, everything that I had when I was at my mother's house. A few months after I got into the nursing home, I filled out an application to get onto Section 8, but I had to wait for more than 2 years before I was able to find a place. I now have an apartment at the Fernwood Apartments. I've been there since I got out of the nursing home back in 1995. I really like having my own place because I'm more free. I can eat when I want to, go where I want. I help other people get out of nursing homes and group homes. Thank you for letting me testify. Anthony Griggs.